Hello, family. Welcome back again. Dr. Anta here. We will be talking about breast cancer, the facts, the journey, the testimonies. Breast cancer is a disease that causes abnormal breast cells to grow out of control and form tumors. If left unchecked, tumors can spread across the body and become fatal. Breast cancer cells begin to enter the milk ducts or the milk producing lobules of the breast. The earliest form in situ is non life threatening. Cancer cells can enter nearby tissue invasion. This leads to tumor that causes lumps or thickening. Invasive cancer cells can spread to nearby lymph nodes or organs, metastasize. Metastasis can be fatal. Treatment is based on the individual, the type of cancer, and its spreads. The treatment involves surgery, radiation therapy, and medications. Key facts from World Health Organization, WHO, July 2023. Breast cancer caused 685,000 deaths globally in 2020. Roughly half of all breast cancer cells occur in women with no specific risk factors other than sex and age. Breast cancer occurs in every country in the world. Approximately 0.5 to 1% of breast cancers occur in men. Now you may be wondering who is at risk. Female gender is the strongest breast cancer risk factor. Approximately 0.5 to 1% of breast cancer occur in men. The treatment of breast cancer in men follow the same principle of management as for women. Certain factors increase breast cancer, including increased age, obesity, harmful use of alcohol, family history of breast cancer, history of radiation exposure, reproductive history, such as age that menstrual periods began and age at first pregnancy, tobacco use, and postmenopausal hormone therapy. Approximately half of breast cancer develop in women who have no identifiable breast cancer risk factor other than gender, just being a female, and age over 40 years. Family history of breast cancer increases the risk of breast cancer, but most women diagnosed with breast cancer do not have a known family history of the disease. Lack of a known family history does not necessarily mean that a woman is at reduced risk. Certain inherited high penetrance gene mutations greatly increase breast cancer risk, the most dominant being mutations in the genes BRCA1. Some refer to it as BRCA1 or BRCA2 and PALB2. Women found to have mutations in these major genes may consider risk reduction strategies such as surgical removal of both breasts. Family, you have heard some facts about breast cancer. Now it's time to hear about the journey and the testimonies. Stay tuned.
And I'm gonna talk about my cancer journey. And well, it's beyond cancer journey. I say probably journey to self, journey to self. So for a while, I've been feeling breast pains, and I've been complaining to my doctors, and they kept sending me to this breast clinic, and I have like what you call fibrosis breast tissue, so I have like lumpy breasts. So for me, I wanted like a mammogram just to be safe, just to know everything was okay, because my lumps would often change like with my cycle or different times throughout the month. So, I always like feel a lump, but I'm like, okay, is it something that's normal? Is it something that's not? It was hard to keep track. So I went to my doctors and I was saying, I'm having breast pains and I'm feeling this lump, and they will feel like different lumps as well. And they will keep referring me to what you call like the breast clinic. So I kept going to the breast clinic. I went there probably 3 or 4 different occasions, and they kept feeling me and sending me back to my GP saying, "Oh, it feels normal. It feels normal. Breast pain, you know, is not inconclusive of cancer, and you're young. There's nothing to worry about." I think the last time I went there, I really had a breakdown, and I was like crying and say, I'm getting back pains, and you know, it doesn't feel normal, and I'm feeling pain, and can I please be seen? Can I please have a mammogram? To be told the same thing. And I was really frustrated, and I really broke down that last visit. Um Afterwards, I wasn't getting better with the back pain, so it moved from breast pains now to back pains. And one day I call my GP, that's my general practice doctor, and I'm telling him, I'm like, I can't function. This pain is too much. I can't, cope with this pain. And he's like, oh, we'll see you in 2 weeks' time. You could come and see us in 2 weeks' time. I came off that phone call because I was in pain. I was on the bed calling, crying. Tried to get up off the bed because I was supposed to do the school run. My back just gave out, and I called 999. I end up going into A&E. I really give thanks to those first responders because the pain that I was in, he gave me morphine, and honestly, it was the best thing ever. Because you could just imagine being in so much pain and just, and then it's just like relief, just a release. And I needed that. And they took me in. Anyway, they did a scan. When they did a scan, they initially saw a fracture in my spine. So the different doctors are like, okay, have you been in a car accident? Did you suffer a fall? Any traumatic injury? I said no. None of those things happened. I remember, I don't know, I can't remember his name, but I remember he was from, Africa, Nigeria, and this doctor in particular took an interest in me. And I must say, it's not, a race thing, but it is a good thing when you can see someone who you can relate to, because I think like that was one of the reasons why my cries were unheard. And then he kept pushing them, and he kept saying, it's not normal for this 35-year-old woman who's normally fit and healthy to have a fracture in her spine. So they did more research, and they realized my T4 and T5 my T4 was fractured. And then they say, okay, we're gonna send you for MRI, CAT scan. I did that. They say, oh, we see lesions on your spine. And I was like, okay, what does that mean? Up to this day, they haven't, they didn't want to use the C word. They say, oh, it's okay. We'll do more testing. We'll send you back for more scans. Blah, 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 blah. Then they came back and they said, oh, we see a lump in your breast. But don't worry, because, they pick up things and it's not always something. We're going to send you back to the same breast clinic. So I go back into this breast clinic. And all this time I'm in hospital. This is, I'm in hospital. I haven't left hospital from since, I went in through A&E. So I'm back in the breast clinic, and at this point, I couldn't walk or anything. I had to be going around in a wheelchair. Even to sleep, I had to sleep upright, and I couldn't sleep on my back because of the kind of back pains that I was in. So, you move from somebody who's regularly fit and healthy, been in the military, passing fitness tests, love to go to the gym, normally fit and healthy, a mother, to running around, building a career, to now can't even lie down on their back or can't even walk in for like 5 minutes, just in pain. So when I go into that office, I remember I don't know her name. I'm so horrible with names. But it was a Filipino nurse that pushed me over and she went with me and she sat with me and then he came and he's like, "Oh, what you doing back here?" That's the breast clinic doctor. I said, "Did you not read my file?" He said, "No, I'll be back." He came back in. He's like, "I'm sorry. We're gonna send you right now for a mammogram and everything." And I'm just looking at him, and at that point, I didn't say anything. So they roll me in. I stand up. I do the mammogram. Then they say, "Okay, we need to do an ultrasound." Okay, they do ultrasound. Because I've been there more than once, and I'm normally a jovial and warm person, and so I had made friends with one of the like the care nurses working there alongside the lady who does like the imaging, and she stepped out, and I looked at her, she looked at me, and she shook her head, and I was like, "What is it? Tell me." I was like, "Nobody is telling me." I said, "Tell me." She shake her head. I said, "It's cancer, isn't it?" She said, "Yes." And I broke down. But then she's like, "Okay, you can't cry and you can't break down because I'm not supposed to tell you. The doctor's supposed to tell you. So I didn't want to get her into trouble. So I kind of like had to put back in my feelings. And then they rolled me back in. And he's like, "Oh, we're very sorry." And normally somebody young as you and I kind of just broke down and I said, "If you just listen to me." I said, "I came here more than once and you kept just touching my breast and sending it back home." I said, "If you had just listened to me." I was like, probably it would have been gone this far. And I'm like, I'm 35. I just had turned 35 in February. I had 2 kids. I just had started my career at the military and, started my life. And it's like everything's just falling apart. So essentially what happened is that the cancer like went through my lymph nodes, went to my spine, and because it softened the bone in my spine, that's why my bone got fractured. So he didn't say anything. And they said, "Oh, we have to do a biopsy of your breast." And that was one of I hated that experience so much because I felt like, when you're in hospital, you're there on your own. Everything you're going through on your own is like there's no family member, there's no friend, like a hand to hold out to or to cry to. It's like you're basically on your own, like battling through this. And I remember just the pain and all the invasive things that they had to do. And I just kept saying to myself, I want to be a mother to my children. And alongside that, like my personal life was falling apart. So it's like my career, because I had started a really good job, but I wasn't permanent as yet, so that was falling apart. And then my personal life was falling apart because I was in a relationship with someone for a long time, and that fell away. And then so it's like my health, everything, just I just wanna. Um, it was overwhelming. It was really overwhelming. So they started with radiotherapy on my back. And after radiotherapy, I did that every day for 7 days. And I did 6 rounds of chemo. Through every round of chemo, the first one for sure, like, totally wiped out my immune system. Like, I was totally down and out. I remember the third one, at this point, I had to put in a PICC line in my arm. They didn't realize that it was infected, so they flushed it. And when they flushed it, it flushed in my system through my blood. And I was out within 15 minutes of them flushing it. So I was back in hospital again fighting another infection. So that was kind of it. I do chemo, back in hospital, chemo, back in hospital, chemo, back in hospital. That was kind of the MO. And I think the plan is to go forward and do surgery. I think at first I got a lot of anger and resentment. I think especially towards the doctors who didn't listen. And I felt like I was silenced and I wasn't heard, and I felt like I should have pushed some more. But I felt like I was doing everything right, by going to my GP and getting referred and going up there. I didn't know what else avenues I could have gone. But I think looking back, what I should have done is probably, if I could, take up private insurance and go to a private doctor and be like, look, can I get some testing? Because health is it. There's no amount of money. Like, there is no price tag on health. Looking back, I wish I've done that. So if I could encourage any woman, I think to do that. Like, if you're not being hard one way, go a different route. Try. You know. I think another thing, I got so closer in God. I had rededicated my life before all of this, but it just got me deeper in faith in Him and trusting Him and asking Him basically for a miracle, because in the doctor's mind, once it's past the place of origin, is stage 4, and they basically give you 4 to 5 years to live. But I'm like, I don't believe in man's report, I believe in God's report. And God has filled a space where a spouse has left, a career has left, a family has left, our friends have left. The people who are around now are genuine solid people. But that space I don't feel missing anymore because of God, really and truly. And I keep trying to push every day and finding a reason. I know of late I've been feeling discouraged. So I was saying that, yeah, God has filled a lot of spaces, honestly, and I just continue to trust Him. I put my faith in Him. Um, I think I've seen so many different perspectives. I've seen perspective of people that I've spoken to, and I genuinely understand. Like, when you're ill, you feel this responsibility to your family, because everybody's telling you, fight, but it gets a point where you get really tired and physically, emotionally, spiritually, and just feel like, okay, you want to feel a sense of peace and a sense of rest and just to let go. But everybody's telling you to fight, because they don't want to feel that pain of losing you, and you feel really guilty. And it's hard sometimes to navigate that. And I've spoken to other people who I know straight up and down has refused any kind of treatment and be like, I'm just ready. And then you meet people who, like, I remember one of the biggest people that I've met, this lady, she found out she had cancer while pregnant, but they couldn't do treatment because she was pregnant. And then when she had the baby, because her cancer was so hard to fight, they were doing all of these chemo. And she told me, just get yourself ready, just prepare yourself mentally, spiritually, physically. And I remember that being, an encounter that touched me, because I felt like, wow, at least with my children a little bit older, that they know I am mommy and they have experiences with me and memories with me. But she literally just had a baby, and I remember talking to her about God, and telling her, like, have faith and pray and believe and trust in Him. And these are words that I had to turn to, and I had to depend on a lot of people praying for me and encouraging me and keeping the faith. And that's what I try to do every day. And to be honest, it's not an easy road. Chemo, cancer journey, radiation, all of it, like the family dynamics, the personal life, the financial situations that arise because of illness. Like, I just got into the prime of my life, and when doctors are telling you basically you only have like less than 5 years to live, it's a hard place to be. It's a hard place to be. But keep trusting God, keep praying every day, keep asking God for favor and for His miracles and for His healing favor. And I'm just trusting that He will turn things around. And if not, I've made peace with it, to be honest. I've reached a point where I'm not afraid. I'm not afraid because I know where I'm gonna go, and that is peace for me. I think for me, it's just I don't want to leave my children. I love my children, and I think especially my younger one, because he's like so young and he's still growing up and still trying to find himself. I want to be a mother to my children. So in my heart, I'm asking God to like just please just let me live to be a mother, you know. And I don't believe my assignment here on earth is done. I believe that I have a testimony. I believe that I can speak to God, to people about God and about His goodness, regardless of my situation, and you know, bring them closer to the Almighty. You know, I really believe, and I want to serve Him and live for Him. So that is my hope, and I think like one of two people come to mind. I think Hannah in the Bible comes to mind. You know, because she wanted a child, and every day she would, you know, go up and pray, and you know, people would even think that she's crazy, and she go and she'd whisper in her heart, and she's like, God, you know, look on your servant, hear my affliction. God, see my heart, see my request, and grant me this request, you know. And God answer her prayer, and I made her happy. And I also think about Job, and I also think about the fact that, you know, the devil, the Almighty, everybody is there, and they, you know, testing Job to see, you know, you using basically Job for God's glory. And Job was able to hold on through his all his ordeals, and you know, God was able to bless him in the end. So these are two things that I really hold on to from the Bible, and I think, you know, I always say to myself, I shall live to see the good works of the Lord in the land of the living. That's something that I always say to myself, and by His stripes I am healed. He died on Calvary to pay for my sins, and cancer has no power here. You know, these are things that I repeat within myself, you know, especially when it gets overwhelming, because it does get overwhelming. You know, I said to myself to try to encourage and uplift myself. I would say the thing you need the most in this journey is positive energy. If you have people around you who are loving, who are kind, who make you feel good about yourself, who can speak to you with gentleness and love, who make you feel happy and not stressed out and overwhelmed and, you know, not hard. I think like stress is one of the biggest factors, and having a big support system. You know, I think like more than anything, I crave to go by a tropical island where I could be by myself and just relax and just enjoy the sunshine and just, yeah, you know, I think like an environment like this in the Western world is also hard because you have all these things on top of you. So you really don't have any time to recover and recuperate, because you feel like you always have to go and do something and pick up the kids and go for, you know, go and cook and go and clean, and there's family issues and kids issues and relationships and spiritual and emotional and financial. It's a lot. So I think like decluttering your life and just finding people who make you feel good about yourself and finding ways to manage your stress is really important, and eating really healthy, and you know, staying as active as possible throughout this journey. But I'm grateful for the people who love me and for the people who pray for me and pour into me. I'm grateful for my children. You know, a lot of times they were the anchor, and I'm grateful to God. And I believe He's doing a good work in me.
Signs and symptoms for breast cancer. Breast cancer can have multiple symptoms, especially when it is more advanced. Most people will not experience symptoms when the cancer is early. Symptoms of breast cancer can include a breast lump or thickening, often without pain, change in size, shape, or appearance of the breast, dimpling, redness, pitting or other changes in the skin, change in nipple appearance or the skin surrounding the nipple, the areola, abnormal or bloody fluid from the nipple. People with abnormal breast lump should seek medical care, even if the lump does not hurt. Most breast lumps are not cancerous. Breast lumps that are cancerous are more likely to be effectively treated when they are small and not spread to nearby lymph nodes. Breast cancer may spread to other areas of the body and trigger other symptoms. Often, the most commonly detected site of spread is to the lymph nodes under the arm, although it is possible to have cancer-bearing lymph nodes that cannot be felt. Over time, cancerous cells may spread to other organs, including the lungs, liver, brain, and bones. Once they reach these sites, no cancer-related symptoms such as bone pain or headaches may appear.
4 years ago, my wife was diagnosed with cancer, and eventually she passed away as a result of the disease. So, what was the experience like? In short, it was one of the most difficult period of my life. The experience, which was so emotionally charged, was as complicated as the cancer itself. It was so hard being on a journey with someone suffering, and there's feeling so helpless. There was not much I could do. There's a sense of wanting to do something, but you can't. You're just watching and waiting for answers. Is it going to be okay? The questions you're asking, you're looking for answers that you want to hear. So it was very complicated, and like I said, emotionally charged. You're stressed one day, a mixture of faith and hope, and then all that coiled in with uncertainty just creates such a roller coaster experience in one's life. We were parents. We had two girls in university at the time, so my resolve now is that, which again, I walked into this thing, if you can say that, without understanding anything about cancer, just knowing that, it's just a word. What it was one I've never heard of before. So you just have no knowledge. And it was the kind of stuff that you don't want to talk about, because it was so scary talking about cancer. So it's that disease that just stays out there. And then when it happens to you, it drives something home. And then you're fearful. But it's so important that it doesn't matter what happens outside of the spiritual aspect. I had to find a balance. And the balance was not with being spiritual or not. It was between taking care or having a knowledge that my wife was sick, and then life has to go on. We have to do business. We have to pay bills. And I was a father. My girls were in university. Do you pluck them out and say, Mom's sick? No, he couldn't do that. So it was very difficult as a man, as a father, just to go on. You didn't, as a man, you don't get the hugs from anybody like some of them. You don't talk about it. I don't remember any male having their wife dying of cancer until my wife died. Then I found out that there are other people who had their wives died, type of thing. So you don't get that information. There's no bonding in that sense, and it's not any casting any doubt or any shadowing on what it is. But it's a very, very lonely experience. And those who experience it just don't know what to say. People don't know what to say. So, and I don't have an answer. I can only attribute that my faith in God and just trust in God for the outcome to be whatever it is, then all things would have worked together for God's purpose. And probably at the end of that, that's the only hope that I could hold on to. Like I said, it was a very difficult period in my life. I wish I could spare. I am not even prepared for this, because you don't prepare for anything. when it comes to dealing with cancer, because of the different types of cancer, the different way it affects us and the way it pops into our life. Today, your life is just literally upside down. And I think that's what happened. You're moving along and all of a sudden you're upside down in a right side world, and it changes everything around you. I do believe that if I can say anything that would help someone, is really to find the balance. We have to find a spiritual balance. Most people don't know how to do that because we do have different beliefs and different way of life. But whatever it is, we have to find a balance to differentiate as we go through this journey, when to stop, where to go, when to turn off, and that life does not end. The stigma attached to cancer is probably the most frightening thing, and probably the biggest enemy to a cancer patient, because the minute you hear where nobody walked around and said, oh well, I'm a flu survivor, I'm a pneumonia survivor. So with that kind of idea to say I'm a cancer survivor, that itself scares you, like, wow, you survived the worst of worst. But in retrospect, it's a very difficult disease. But it's not the disease that's uncurable. It's not the disease that we can't fight like everything else. Anything can happen in life. But with a good balance, with finding as much not of the cancer, but how to survive, and realize that we're all. While my wife was lying there being sick, I was standing up there also being sick. And in most cases, I could have been sick as a result if I didn't find that balance. So I hope that this can benefit someone. I don't know if this experience is what it is, but there's no prepared statement you can make on having a person diagnosed with cancer close to you and watching them pass away. There's just no word, no more than I'm grateful to God that she has gone on to be she's gone ahead of me and most of us, and we can go and join her. She can't come back according to David, but we can join her, and her life was wrapped up in Christ, and we ought to just be prepared for any kind of uneventualities in life. That's the bottom line. And cancer is just not the worst of whatever can happen to a person.
Yes, family, you have heard it. Breast cancer, the facts, the journey, and the testimonies. Now, what are we going to do? We're going to pause just now, and we're going to do some introspection. Who do we know have breast cancer? Who do we know are breast cancer survivors? Let us try and do something different in our lives. Extend ourselves. Send a voice note. Send a card. Send a shout out on the media, any media platform. Let them feel that they are loved and they are not alone. Let us be there for our family members. I would like to use this opportunity to thank my 2 family members for giving their testimonies. Indeed, it was very inspiring. And we know definitely what to do. We know how to deal with situations and how to move forward. We don't necessarily have to be in the medical arena. We can be on the outside. But just let us be there for persons who we know. Or it may be somebody in our office who has a family member. Send that greetings. Make a difference. You can do it. I know you can. Let us change this doom and gloom trajectory. Bring some light, some sunshine, and some hope. Bless you, bless you, bless you all. Stay tuned for more facts and what else to do to prevent this cancer. WHO response, July 2023. The objective of the WHO Global Breast Cancer Initiative, GBCI, is to reduce global breast cancer mortality by 2.5% per year, thereby averting 2.5 million breast cancer deaths globally between 2020 and 2040. Reducing global breast cancer mortality by 2.5% per year would avert 25% of breast cancer deaths by 2030 and 40% by 2040 among women under 70 years of age. The three pillars towards achieving these objectives are health promotion for early detection, timely diagnosis, and comprehensive breast cancer management. By providing public health education to improve awareness among women of the signs and symptoms of breast cancer, and, together with their families, understand the importance of early detection and treatment, more women would consult medical practitioners when breast cancer is first suspected and before any cancer present is advanced. This is possible even without mammographic screening, which is impractical in many countries now. Public health education needs to be combined with health worker education about the signs and symptoms of early breast cancer so that women are referred to diagnostic services when appropriate. Economical cancer prevention food tips. Sun and sardines, vitamin D from the sun. Folate, dark green vegetables. Spice it with ginger and turmeric. Beans and lentils. Dark chocolate. Berries. As a bonus, consume the recommended amount of water daily and avoid processed food. Go as natural and organic as possible. Please don't forget your fruits. Family, you have heard it. Cancer, breast cancer. The facts, the journey, the testimonies. Now, let us be ambassadors of great, positive, healthy changes. Together, we soar and succeed. The time is now. Bless Bendiga.